Hello, everybody, and thank you for tuning in to the Liberty Report. With me today is Daniel McAdams, our co-host. Daniel, good to see you.
Happy Monday, Dr. Paul. How are you?
Very good, thank you. Let's talk about viruses and coronavirus, and have we reached the end of this fiasco?
Nightmare.
Every once in a while you hear something good reported and you think, well, just hold your breath for a minute and it might change, because a month or so ago it came out where it sounded like even the authorities were softening up. And they say, maybe we don't have to test so many people. And this was reported actually by HHS. They said, the people that have been exposed, but they're not sick and have no symptoms, there's no reason that everybody has to be tested. So they were backing off on less testing. And the claim was that the CDC approved of this. It's not like they're following science where there shouldn't be a big debate over that.
Yeah.
But anyway, they did that. And but now it's been reversed. They say the CDC is coming out and say, oh, we have to do a lot more testing. And I don't know, maybe it is that they're not getting enough cases.
Yeah.
By their definition. Of course, their definition of cases and the need to build up these numbers is quite a bit different and easier to do it. You just need to do some testing. So here they were not testing as much, and this has now turned into a controversy on when to do it, because they were arguing that even if you have a test, due to the significance of asymptomatic and pre-symptomatic transmission, this guideline further reinforces the need to test asymptomatic persons.
Yeah.
And if there's any hint to it, you have to. They're talking about the quarantine. It used to be where there was just a suspicion, you had to be quarantined, you just came into the country or something, but everybody has to be 14 days. And there was the one suggestion here that, even if it's within the family, you have to have separate bedrooms, this sort of thing. And you can imagine, I get more and more stories about this nonsense going on how upset the kids are getting.
Oh, yeah.
The kids are continuously getting upset. So I think the information, even if you try to sort this out and be scientific about it, I don't think anybody should depend on HHS or the CDC for scientific information. I think you should look to them, and we do. We look to them. What's the political thoughts? Because they're politicians, and it's designed for building an image. And even though something scientific might slip in, it might turn out that it doesn't fit the scenario that they want. They're not getting enough cases, so they go on and they then have to go looking for changing of the rules. And the more I look into this, the more I find out that the coronavirus is universal. It's every place, and these tests are very unreliable, and yet they depend on this to promote the hysteria. And believe me, there's still a lot of hysteria. I don't think anybody has started to move away from this, except in special places, and hopefully that continues, because we've encouraged that. But right now, the government has not backed off. It's almost like they buckle down. If it looks like they're losing the position they have of controlling the media, then they say, well, we'll change the way we test. We're not going to ease up. We're not going to follow common sense. And then they will demagogue it back to testing. More cases. And then again, we go back to reading the hysterical reaction to this.
And we've done several shows like this, and we did one last week, I think, where the CDC just flip-flops. Wear a mask, don't wear a mask, wear a mask, don't wear a mask. And we kind of make fun of it, and hopefully to undermine the credibility a bit. But here, just last month, the CDC said, if you're asymptomatic, you don't really need to get tested. It's no big deal. On Friday, they flip-flopped. If you've been in contact with anyone who has COVID-19, get tested immediately. Self-quarantine, like you said. Lock yourself in a closet for 2 weeks. Don't go anywhere. And it's just remarkable how they flip-flop. And again, you do wonder, I drove by one of those COVID testings after church, and there was nobody there. They were sitting around twiddling their thumbs. So maybe they don't get enough people. But the question that I have about this whole thing, the whole point of public policy is to be able to adapt to changes in inputs and outcomes, and to be able to, to sort of be living and breathing. But they're still relying on this idea that we have to prevent people from getting this virus at all costs. And it's, as we joked about it, it's the only pandemic in history where you have to be tested to see if you have the virus, But we can look to Sweden, we can look to South Dakota to see what happens when you don't, you could even look to Texas, when you don't obsessively try to prevent people from getting this virus, average people, especially people that are not susceptible to getting sick, like young and very healthy people, right? Rather than protecting the people that are susceptible. But we're still in that phase one where, oh my gosh, nobody can get this virus. Well, when that happens, as soon as you open up, it does what viruses do. It viruses, you know, and so it's just hard to imagine that we're still back at this place.
Well, if they do these testing when they shouldn't be doing the testing, and they don't find one, they keep testing, you know.
Yeah.
And the CDC says a single negative test does not mean you will remain negative at any time in the future. So why do they do the test? And you might as well wait. There's no, when do you end? When do you end testing?
Yeah.
Well, you know, that's true. You might get a positive test. You might have come across a virus. You might get a cold or something, and it might turn out positive. But they continue to do the same things over and over, and the people are getting very frustrated with it. And they always claim, in this article that we looked at, they're always claiming they want to follow science.
Yeah.
They're trying to get the people on the same page, and they all follow science. And to me, I think it's almost the opposite. They have to be on the same page because they presented a case a month ago. Maybe we were doing too much testing, and all of a sudden, and this was said to be supported by HHS and a CDC, and then all of a sudden we have to change.
Yeah.
So that's hardly getting science on the same page, because I think you spoke the science correctly right now, that they don't need to do all this. So that's the problem that we face in convincing people that there's another way. I read one short story. I don't have the full story of it, but 1,000 doctors got together in Europe and complained about this nonsense that's going on, and they took a scientific approach. So there are more people speaking up, but that's what we really need now, is ammunition from scientific people. But what's the problem there? Are they going to get on a 4 networks or 5 networks,
or
is
banned,
it
banned from every network?
Well, that's for sure. So the process continues. So what do we have to do? We have to talk to ourselves and our friends
Our
out
audience,
there
that's
who
right.
do some. But the numbers are growing of being skeptical of this, and we certainly pointed out the statistics to show that everybody's breathlessly waiting for the vaccine, but the longer they wait, the higher the numbers get of people say, I'm not taking the vaccine. So that's good.
It's good. The thing about the tests is that they can always be used and manipulated by people who want to keep this scamdemic going, this plandemic going. And that is, okay, say you test 3 months ago and you test positive. Maybe you had a sniffle for a day or two, and then 3 months later you're completely better. You still are counted on the rolls as a case of COVID. They don't subtract you, and they also, as we've talked about throughout the show, they will hold these back and drop some cases on a slow week to make it look like we're not getting any better. But Dr. Thomas File is the president of the Infectious Disease Society. That sounds like a lot of fun. He was cited in this ABC News article that we're talking about, and he calls this flip-flopping of CDC a return to a science-based approach. And of course, whenever it agrees with you, it's science. Whenever it doesn't. But the other thing that he said that struck me, Dr. Paul, he said, lack of testing has been a weak point in the country's response to COVID, to coronavirus. That doesn't seem right. We've tested more than any other country in the world. What is really the point of testing? If you're not sick, you don't get sick. Well, the point is, as you've said so many times, is to create this idea that there's a new thing called a case. You don't have any symptoms, or you're not very sick at all, you have a sniffle, but you're a case. And that's never happened in history.
Yeah, I remember early in my medical training, we weren't supposed to be treating tests. We were supposed to be treating a patient. Yeah. And just because a test says something, you have to look at the patient in its entirety. And this is a statement that very much reiterates what you said, and this comes from File, president of the Infectious Disease Society.
Yeah.
And And I think the wording is very clear. The return to science-based approach to testing guidance from the Center for Disease Control and Prevention is good news for public health for our fight against this pandemic. We urge officials, and this was your point, urge officials to support the work of controlling this pandemic by following medical guidelines of experts.
So
if we're not the experts and our friends aren't the experts, they're all in the government.
Yeah.
We put them all in the government, and that's why, of course, we could argue that case for everything. That we have all kinds of experts in the government to tell us how to live and what to do in all areas of our lives.
Yeah, that's true. We can actually even put up that first little picture so that people know that what we're talking about. But you wanted to go on to the next thing, which is a related thing about what's happening, and this is sort of contradicts what we said just before. The testing czar.
Right. This comes from the testing czar,
Yeah.
From the HCS, Health and Human Service, HHS. The testing czar says cases are down.
Oh.
Sounds okay to me. Even as U.S. nears 200,000 COVID-19 deaths.
Yeah.
And of course, we've gone through that so many times. How do they measure it? Not only is the testing of who's sick and who has to be watched and who has to be quarantined, the whole collection of the deaths. Did you die with or because of COVID? And that continues, that they fudge it, and they're only credible if they can show it. But you've put up the chart so many times to show what reality is all about, how the chart goes down to zero again, and then the blips can be explained, the backlogging and putting it together and not checking to find out why did they really die? Are the people it's artificial, with the nursing homes anyway, but how about how many diseases do they have when they became positive? So so out of that 200, there's no way anybody's ever going to figure out, but I'd be inclined to say that 200,000 people didn't die because they up and got the COVID virus and they died from it.
Yeah.
A clear distinction of what their diagnosis was. But nevertheless, makes good headlines, and that's what stirs up people, and that's what scares people, and the fear that they develop and hysteria that develops. It's unfortunately in the hands of our government officials, but thank goodness more and more people don't believe the government anyway, so we'll have to keep working on that, keep reassuring ourselves.
But the good news for you is that the CDC agrees with you, Dr. Paul. 94% of the people who died from COVID actually had several 2.6 on average serious comorbidities. So,
I don't think the CDC's reporting that very often.
No, they're hiding that. In fact, they're calling it fake news. But here's something on those same lines, and this is just something from Alex Berenson, who's done such a great job covering this. This is something he put up. If you'd like to know how the U.S. has reached 200,000 reported COVID deaths, the Milwaukee Coroner's Office is a good place to start. It reports the anonymized death certificates of COVID cases, just a few of the most recent. And let's go to the next one, actually. This will give you an example. But here's what it says. He just grabbed 3 at random, Dr. Paul. Here are the 3 coronavirus deaths. A woman, 90, in renal and heart failure. A man, 84, with prostate cancer, dementia, and heart disease. A man, 88, with heart and renal failure, AFib, diabetes, and Parkinson's. Yes, all 5. Can't make it up. All in the first 20 cases, Alex writes, all called COVID deaths. And that's what's happening. And even actually look at this next one. These aren't deaths, but these are cases, because we've talked about this too. This next clip, this is fascinating because we talk about based on the original day that they were tested versus when the tests were reported. Look at the difference on positive results, Dr. Paul. The top one is when you do it by the day of the testing. When you look at it that way, it looks like, wow, the cases are really almost gone. They've declined. But now that you can see on the bottom one, that's the backloading. That's reporting things months later. And that's where you get, it looks like a second wave. Everybody better lock down, put on your mask, go get tested. This is a total mislead.
Could we file that under fake news?
Fake news, big time.
Well, I want to get a quote again from the czar of HHS and what his reaction is to all this. He says, we do have a formula to reduce these deaths that don't exist. Reduce the cases, but we all have to be disciplined.
Uh-oh.
This is what I think is driving this whole thing. We all have to be disciplined. They're not talking about themselves other than being disciplined to make us obey them. Be disciplined and diligent to make sure we obey that every single day, and that is the lockdown and the distancing and the mask. And they even want us to, I mean, they're just out of their minds. They want us to wash our hands every day.
Every day.
Every day we should wash our hands. Well, anyway, it's a shame because I can't help but think that people do die from the disease,
yes.
And it's sort of like people die from automobiles, but we haven't eliminated the automobiles from the highways. We try to teach people, to how to drive, but in this case, just fear mongering doesn't work, and that's what they're working on because medicine and science is hard for people to grasp, and they want to be told what to do, and they look to the politicians. Even it's a mysterious thing that most people despise the politicians and despise the government, but they beg and plead for the government to take care of them. Both they want the money they need to take care of themselves to tide them over, and they want the pills that they need. They want the vaccine that they need, and they teach people. And you've seen this. They teach the people to spy and get angry at their friends and neighbors and even family members. You're not doing right. I've heard some terrible stories about that. They stay vicious, and they never stop and think, well, he's not hurting me, even if they believe in it. We have no objection to that, and at times they should.
Yeah.
But this whole thing is they think that if they see something, I've heard people just shouting across a room.
Yeah.
They think that all of a sudden, because they're in this room, they're going to do it. Why don't you have a mask on? I mean, the hysteria is just out of control for some people.
And the thing is, we are not making light of the fact that a lot of people have died. They do die of the flu and of colds every year, and it is tragic. But what we're talking about is the cruelty of, as you always say, locking down children, destroying colleges. Adam Dick at RPI wrote about this over the weekend. There was a college, New York University, a student was online only. Right, he wasn't on campus, online only, and he actually went and got together with a couple of other colleagues from the college to talk about college. Well, they found out about it, and the kid is suspended permanently because you're not allowed to meet anyone.
Oh.
So anyway, that's what they're trying to do, and the cruelty of it, and we'll talk about this in a couple of minutes. But in our own governor, Greg Abbott, he had a big press conference on Thursday where he magnanimously allowed people to visit their elders in the nursing homes, which you could say that's a good thing because these people are suffering, in isolation. But he refuses to open the bars. And you think about it, generally people in the nursing homes are more susceptible. And I'm not saying he shouldn't have opened it, but generally the people that go to bars probably, unless they're really bad bars, but probably younger and more healthy, right. And they go there to socialize. So none of it makes any sense. It's just pure cruelty.
I want to get another quote from the czar from HHS because this is what he wants us to be obedient to and obey what he wants. He quotes, "Biology is independent of politics." I mean, Daniel, we're off track.
We are off track.
Well, I guess we're obsessed with politics. If you cannot physically distance all the doctors, all the public health experts, all of us are really unanimous that it's important to wear a mask when you cannot physically distance. So there it is. It's very simple. They're the scientists, and we're just scaremongering.
Yeah.
But I think that there's going to be a lot more people agree with this as time goes by.
Yeah, and it is breaking down a little bit. So if you're ready to move on from our
right.
friend the czar, I have just a little quickie that I wanted to put up there, and I don't know if you want to comment on it or not, but this is something that I noticed that was kind of interesting. Healthcare workers may be less, not more, susceptible to coronavirus, study suggests. And that flies in the face of some of the things that you hear. But this was a study at Hoag Memorial Hospital Presbyterian in Newport Beach. They tested 3,000 workers, health workers, and they found that only 1% of those had coronavirus antibodies, whereas in the normal surrounding population of that area, it's between 4 and 6%. And it's pretty interesting. I don't know what the conclusion is other than just having the antibodies may not be as significant, and maybe the T-cell memory that I'm not qualified really to talk about. But there are other factors in there. So I guess the main point is the quote-unquote science really isn't settled on this, on who gets it and who doesn't get it.
That's right. You know, I want to make a I comment on something I saw on Target Liberty, Bob Wenzel's thing.
Wenzel,
yes. This is entertaining, but it's also significant of the insanities going on. But if we can put a little ridicule on somebody that they deserve, we should do it. But this had to do with a group in Germany, and sometimes the Germans say something good, and sometimes they do silly things. But this one was pretty silly. They wanted to follow the rules, so the soccer team got up and said, "This is bad. This is bad." So we're going to have this soccer game, and one team decides that it was social distancing. Can you predict who won?
Let me guess.
37-0. The people who did it, and you know, in a way, it is a lesson. Maybe social distancing's results are, 37-0 in all that we do, because the social distancing really doesn't work.
Yeah.
I mean, if we did a little bit of understanding of proper distancing, maybe we wouldn't have had so many people die in our nursing homes with political decision. So I thought that was a little bit over the top.
Leave it to the Germans. Well, I hate to now say something that's less fun, but I'm going to do my last segment if you think we're ready. And this is closer at home, and I suggested this. Let's pick up this next picture. This is really terrible. Governor Abbott had his press conference on Thursday where he allowed restaurants to have a few more people going in them. But he said, nope, you can't open the bars, forget it. And the bar owners are absolutely devastated. And people, maybe they have I don't go to bars, but they have the idea that bars are these, dark places. But you think about the idea of the brew pub and these things like this they're more social gatherings. No, you can't do it. Here's one. He's a representative of the Bar Owners Association. I don't understand how you can open Texas Stadium to 30,000 people and still shut down bars for 5 months. And that's a good question that the governor hasn't answered. But what's happening? Are people saying, oh my gosh, I better stay home with my mask on? No, what they're doing is they're being human. So what they're doing is they're going to restaurants and having a drink at a restaurant instead of having a drink at a bar. Same thing, it's just that the bar owners are getting punished because Grab-It Abbott is picking and choosing who gets to survive and who doesn't. And I think that is really awful. And let's look at this next thing. This is our friend Alex Rodriguez, who does a lot of great work on Texas. How can you justify keeping these places closed when you look at deaths by day of death in Texas and look at that curve? Look at that curve. They're reporting old deaths, but when you look at the deaths on the day they occurred, really it is almost gone. And Dr. Paul, I am going to mention that we will have our supers that we thank, our super chatters that we're going to thank after the show, and we appreciate you keeping the show going. And I know, Dr. Paul, you wonder what I do on my weekends. Am I diligently working? Am I trying to get into one of those bars that are closed? Well, I do have some information for you. Here's this last picture. Here's what I was doing this weekend, Dr. Paul. I was out in front of Walmart with a great group of people. If you can have that last picture. Here's me. I'm carrying a sign. We're saying, take off the mask, no more hysteria. There's about 20, 30, 35, 40 people there. A lot of kids running around with signs, take off the mask. We got a lot of people honking, a lot of thumbs up. We only got 2 people. One of them had something up, but it wasn't a thumb. But there wasn't much. We even saw a member of your family drive by and give us 2 thumbs up. So it was a lot of fun, and I'm really proud of these great people who put in so much effort to open their communities up.
Well, I don't know why you did it. The evidence is there. The enemy's going to know who's leading the charge. But I think we're on record already. And they've already been after you. So I think that, I think back at the beginning of this, starting at the beginning of the year, and I was sensing a problem. And I used the term of this being a hoax, and it was never the hoax of the virus. The virus was there, and everybody knew that, and the viruses are dangerous. The hoax was the way they were presenting the science to it, and the way it didn't take long to realize they were scaring people. And I think a lot of people know that now, and there's a lot of skepticism. But I want to make this point again that what we're getting now is the information, like Daniel has pointed out, these statistics that show that what they're presenting to it is just flat out wrong. But The lockdown versus the virus, which is the dangerous? Well, the hoax of the lockdown and what they're going to do and the reaction to it and the hysteria associated with it and making kids upset and the psychiatric diseases and the anxieties that have been caused. There has been some people who have done this scientifically and tried to measure this, which is the most dangerous. And there are some who came up with the conclusion that it's twice as many people die from the lockdown. And the financial injury is probably, we'll never measure it. And yet still emotionally, yes, but maybe 3 more people died, which is not true. Even there's less deaths, there's not more deaths because we don't have lockdown, because so many of these things that they do just aren't worthwhile. But still the people are under the perception that we have to do it because somebody might die by not doing all these things, and that's why they have kids now playing soccer as long as they don't touch their opponents in playing the game. The silliness of it all. So this is something that I think the people are waking up, and I'm so delighted that we have an audience that has an agreement with us on what we're doing and what the government is trying to do to us and trying to sort out fiction from science and where the problems are coming. But it certainly is a problem, and right now it's getting severely mixed up with the economic downturn, which was going to be there anyway, but has been magnified tremendously by coronavirus lockdown and all the things going on with the riots on the streets. So this is made for difficult times, and unfortunately, I wished I could say that if you just listen to us about lockdown and talk about a few things there, it's going to solve all these problems. But the problems are bigger than this, and I think it's going to continue. But this is stuff that is unnecessary. This is man-made, just like most of this is man-made, created. I mean, the whole mess with the business cycle and the Federal Reserve, that's created by man. They would like you to dwell on the fact that the heat waves are all caused by man. All fires, everything natural is caused by man. But the things that man really creates, like the unhappiness and the difficulties and the complications of lockdown, and also the consequence of spending too much money and printing money. Oh no, we don't deal with that because unfortunately there's too often bipartisan support for those type of man-made issues. The rest of it is all politics that goes on, and this is a political fight as much as anything. That's why it should be simplified. And for me, I like to have it simplified. And as the purpose of government should be very limited. It should be there to protect our liberties. It should be open where people assume responsibility for themselves and the markets work on their own. Oh no, that's way too dangerous. What we have to do is find the best people in this society that knows what's best for everybody else and give them authority to take care of us. And if you have a bad virus come in, let them tell us exactly how to live because they're the only ones that know how to do it. You, as an individual, they claim is incapable of doing it. Unfortunately, I have had members of Congress in a sort of a polite discussion saying, Ron, you're sort of right on this stuff, but the people are just too dumb. And that is why they need us in the Congress to take care of them. I found that rather disgusting, but I find it rather exhilarating and encouraging when I meet many of you and talk to you and you give us support and you promote the ideas of liberty, because that is where I think so many of our problems can be corrected. And that is our goal, is to substitute the nonsense we have in Washington with the principles of liberty. I want to thank everybody for tuning in today to the Liberty Report. Please come back soon.